sustain our lives by eating, absorbing nutrients, and converting them into energy. Among these processes, one of the most crucial is the conversion of sugar from food into energy. Today, I want to talk about diabetes. Diabetes affects the body in many ways, but it can be difficult to detect in its early stages. However, the body actually sends out several SOS signals. If these warning signs are ignored and left untreated, diabetes can progress to a life-threatening stage. That's why, in this video, I'll introduce 7 unexpected yet dangerous signs of diabetes that you should be aware of. It is estimated that 1 in 10 people currently has diabetes. In real clinical practice, many patients seek medical attention only after the disease has advanced significantly. Some have undergone amputations, others require dialysis, and some have lost most of their vision. What makes diabetes so dangerous is that even when early symptoms appear, they are often mild and easy to dismiss. By the time noticeable symptoms develop, the disease may have already reached an irreversible stage. In this video, I'll help you check whether you have any of these warning signs and explain them in a way that makes them easy to recognize early. If you've been feeling that something about your body is a little off, but have been telling yourself, it's probably nothing, you might actually be putting yourself at serious risk. That's why I encourage you to watch until the end and learn about these critical warning signs. Some of you watching may already be health conscious, while others may have been diagnosed with diabetes. YouTube offers a wealth of medical information, with many doctors and professionals sharing valuable insights. However, some videos provide conflicting information, some simply list symptoms without explanation, and in rare cases, some even spread misinformation. For this reason, in this video, I will not only introduce the symptoms, but also explain why they occur and in what order they typically appear, based on how the body functions. This will be a relatively long video, but I encourage you to watch until the end so you can make informed decisions about your health, avoid being misled by incorrect information, and gain the right knowledge. First, I'll explain the mechanism of diabetes in a simple and easy to understand way. Then, I'll go over the dangerous SOS signals of diabetes, breaking them down into 3 major stages based on the order in which they tend to appear. How does diabetes develop? Many people mistakenly believe that diabetes is simply a condition in which sugar appears in the urine. However, this is not entirely accurate. Many individuals with diabetes do not have sugar in their urine at all. The key to understanding diabetes lies in insulin. Our bodies obtain nutrients from food and convert them into energy to sustain life. Insulin plays a crucial role in this process by helping the body use sugar, a glucose, for energy. While insulin is commonly associated with lowering blood sugar levels, what it actually does is enable cells to absorb and utilize glucose, which in turn reduces the amount of sugar in the bloodstream. However, if insulin does not function properly, glucose cannot be efficiently used as energy, leading to elevated blood sugar levels. When this condition persists, diabetes develops. In other words, diabetes is a disease in which the body struggles to use sugar as energy, resulting in an energy deficit and various complications. Why does insulin stop working effectively? The most common cause of insulin dysfunction is obesity due to overeating. When excess fat accumulates in the body, insulin becomes less effective, making it harder for cells to absorb glucose. This leads to persistently high blood sugar levels and, eventually, diabetes. Understanding insulin's role makes it easier to grasp how diabetes develops. However, obesity is not the only factor. You may have heard that diabetes runs in families. In fact, if both parents have diabetes, their child is estimated to be 5 times more likely to develop the disease. This is because insulin resistance, the reduced effectiveness of insulin, is often inherited. That being said, inheriting insulin resistance does not automatically mean a person will develop diabetes. If someone with this genetic predisposition maintains an unhealthy diet and gains excess fat, insulin function deteriorates further, significantly increasing the risk of diabetes. There is also a form of diabetes known as type 1 diabetes. Unlike type 2 diabetes, which is often linked to lifestyle factors, type 1 diabetes can develop regardless of diet and exercise habits. While some cases are influenced by genetic factors, lifestyle choices are not a contributing cause. Many people associate diabetes with poor dietary habits, but it's important to recognize that type 1 diabetes is fundamentally different from type 2 in this regard. Regardless of the cause, whether obesity, genetic predisposition, or other factors, diabetes develops when insulin function declines, preventing the body from using glucose for energy. As a result, blood sugar levels rise, and prolonged high blood sugar leads to a diabetes diagnosis. Understanding this mechanism is key to making sense of diabetes symptoms. Diabetes symptoms can be broadly classified into three types: symptoms caused by high blood sugar levels, symptoms that appear as diabetes progresses and high blood sugar persists, symptoms resulting from impaired insulin function. Breaking symptoms down in this way helps to clarify the order in which they tend to appear. Among them, the most important to recognize early are the initial symptoms, as early detection and intervention can significantly impact disease management. Here are three common symptoms that may appear when blood sugar levels become too high. The first symptom is dry skin. You might be wondering, is dry skin really related to blood sugar levels? The answer lies in the way high blood sugar affects blood vessels and fluid balance in the body. Blood vessels run just beneath the skin, and when blood sugar levels rise, osmotic pressure pulls moisture from the skin into the bloodstream. This causes the skin to lose hydration, leading to dryness. In addition, persistently dry skin can result in a condition called xerotic eczema, which causes inflammation and itching. Itching isn't just due to dryness. It can also be caused by nerve damage from diabetes or by uremia, a condition where kidney dysfunction prevents toxins from being properly eliminated from the body. Since people with diabetes often experience dry, itchy skin, it's important to be aware of this connection and take steps to keep the skin hydrated. The second symptom is a weakened immune system. Many people don't realize that diabetes makes them more vulnerable to infections, including something as common as athlete's foot. Itchy skin can be one contributing factor, but beyond that, diabetes weakens the immune system, making it harder for the body to fight off infections. If you've noticed that you're getting sick more often than usual, it could be a sign of high blood sugar. But why does diabetes weaken immunity? Our bodies rely on white blood cells to fight bacteria and viruses. Normally, white blood cells circulate through the bloodstream and eliminate harmful pathogens. However, when blood sugar levels are too high, the function of these immune cells declines, reducing the body's ability to defend against infections. A weakened immune system doesn't just increase the risk of athlete's foot, it can also make other infections more severe. For example, cellulitis, a bacterial skin infection, can cause redness, swelling, and fever. In some cases, it requires antibiotics to prevent it from spreading deeper into the muscles and bones. If left untreated, the infection can lead to tissue necrosis, which may require surgery. In extreme cases, it can even result in amputation of the fingers or feet. The third symptom of high blood sugar is excessive thirst and frequent urination. These symptoms tend to appear when blood sugar levels rise sharply. Even before diabetes is officially diagnosed, a sudden spike in blood sugar can trigger these early warning signs. Many people don't realize that diabetes can cause frequent urination. The most commonly known causes of frequent urination include an enlarged prostate in men or an overactive bladder in women. However, in diabetes, the cause is different. It's due to the body producing a higher volume of urine overall. Here's how it works. When blood sugar levels become too high, excess sugar spills into the urine. Since sugar naturally attracts water through osmotic pressure, more water is drawn into the urine, increasing urine production. This leads to more frequent urination. Because the body loses so much water this way, dehydration sets in. As blood sugar rises, the blood becomes more concentrated. To correct this imbalance, the body signals the brain to drink more fluids, leading to increased thirst. If you've recently been feeling unusually thirsty or drinking more fluids than usual, it might be a sign of high blood sugar. One serious risk is that people often reach for sugary drinks like sports drinks or fruit juice to quench their thirst. Unfortunately, these drinks cause blood sugar to rise even further, creating a vicious cycle where the body demands even more fluids. In severe cases, this can become life-threatening. This condition is sometimes referred to as soft drink ketosis or bottle-fed syndrome. These are three common symptoms that can appear relatively early when blood sugar levels rise suddenly. If you notice any of these signs, it's important to take them seriously and consider checking your blood sugar levels. Now let's talk about the symptoms that can develop when blood sugar levels remain high for many years. In other words, after a long period of living with diabetes. As mentioned earlier, prolonged diabetes can lead to serious complications, such as the need for dialysis, limb amputation, or severe vision loss. In this section, we will focus specifically on the symptoms caused by consistently high blood sugar. One of the most common complications of prolonged high blood sugar is eye problems. In some cases, people are diagnosed with diabetes only after seeking medical attention for vision issues. Lately, my vision has been blurry. When I look at a white wall, I see black specks floating around. Should I see an eye doctor? In fact, symptoms like these can be caused by diabetes-related complications. Diabetes primarily damages blood vessels throughout the body, and the smallest blood vessels are the first to be affected. When these blood vessels become damaged, noticeable symptoms can appear. But why are smaller blood vessels more vulnerable? Blood vessels transport blood, and their walls are lined with special cells called vascular endothelial cells. When blood sugar levels are too high, excessive sugar in the bloodstream generates harmful substances called reactive oxygen species, which damage these endothelial cells. Imagine coarse sugar crystals flowing through your veins. Just as rough particles can scratch a surface, high blood sugar can damage the delicate walls of your blood vessels. Because smaller blood vessels are more fragile, organs that rely on them, such as the eyes, tend to develop symptoms earlier than other parts of the body. However, many diabetes-related eye problems progress without any noticeable symptoms at first. That's why, whenever I diagnose someone with diabetes, I strongly recommend that they visit an eye doctor. If the condition is detected too late, vision loss may become irreversible, making daily activities, such as working, cooking, and even recognizing faces, much more difficult. Vision plays an essential role in everyday life, so early detection is critical. The symptom of seeing black specks floating against a white background is called floaters, also known as muscae volitantes in medical terms, which means flying flies in Latin. The name comes from the way the specks resemble tiny flying insects. While floaters can have various causes, in some cases they may be linked to diabetes. If you experience this symptom, I strongly recommend seeing an eye doctor as soon as possible. Another major complication caused by prolonged high blood sugar is nerve damage. Our bodies contain a vast network of tiny blood vessels, including those that supply essential nutrients to our nerves. Nerves are spread throughout the body and play a crucial role in movement, sensation, and overall bodily function. Since nerves rely on small blood vessels for oxygen and nourishment, they are highly vulnerable to the effects of high blood sugar. Among the complications of diabetes, nerve damage is often one of the earliest to appear. On average, symptoms begin to show about 5 to 10 years after diabetes develops. Common signs include numbness, tingling, pain, or itching, especially in the hands and feet. A key characteristic of diabetic nerve damage is its glove and sock pattern, meaning that symptoms typically start in the fingers and toes, which are the areas covered by gloves and socks. Another distinctive feature is that symptoms usually appear symmetrically on both sides of the body. For example, if someone experiences numbness in only one hand or one foot, the cause is unlikely to be diabetes. However, If both hands or both feet feel numb or tingly, it could be a sign of diabetic nerve damage. This pattern occurs because the fingers and toes contain a high concentration of small blood vessels, making them particularly vulnerable to poor circulation caused by high blood sugar. Since nerve damage reduces sensation, people may not notice injuries such as blisters from shoes, burns, or small cuts on their feet. Left untreated, these minor wounds can become infected, increasing the risk of serious complications. This is why people with diabetes are more prone to foot infections, including bacterial infections and conditions like athlete's foot. The connection between nerve damage and frequent infections is often overlooked, but it plays a significant role in diabetes-related health problems. If you or someone close to you frequently develops blisters from shoes or has multiple foot wounds that go unnoticed, it could be a warning sign of diabetes. Because foot injuries can be easy to miss, it's important to check regularly. As diabetes progresses, the body produces less and less insulin, which leads to various symptoms. Additionally, when insulin becomes less effective, the pancreas tries to compensate by overproducing it, which can create dangerous conditions. I will discuss two major symptoms that result from these changes. The first symptom is weight loss due to decreased insulin production. Some people may think, isn't diabetes a disease that makes you gain weight? While it's true that diabetes is often associated with dietary habits that lead to weight gain, the reality is that as the disease advances, weight loss becomes more common. Let's take a closer look at why this happens. To understand this, let's revisit how diabetes works. Insulin is a hormone that helps the body convert sugar into energy. However, when insulin production stops completely, the body can no longer use sugar for energy, no matter how much is consumed. As a result, even if a person eats normally, their body cannot absorb enough nutrients. In response, the body starts breaking down muscle and fat for energy, leading to continuous weight loss. The second symptom is an increased risk of cancer due to excessive insulin production. One of the main causes of diabetes is reduced insulin effectiveness. When this happens, the pancreas, which is responsible for insulin production, compensates by making more insulin. This is especially common in diabetes cases linked to obesity. When insulin doesn't work properly, the pancreas overproduces it in an attempt to regulate blood sugar levels. However, research suggests that this excess insulin may increase the risk of cancer. In addition to diabetes-related weight loss, cancer itself can accelerate the process. Malignant tumors consume large amounts of nutrients as they grow, depleting the body's energy reserves and causing further weight loss. As cancer progresses, overall health declines, fatigue worsens, and appetite decreases, leading to even more rapid weight loss. No matter the cause, an unexplained weight loss of more than 1 kilogram in a month is a warning sign. If this happens, it's important to seek medical attention as soon as possible. Certain types of cancer can also cause a sudden rise in blood sugar levels. One of the most well-known examples is pancreatic cancer. Since the pancreas is responsible for insulin production, the presence of a malignant tumor can disrupt insulin production, leading to a significant drop in insulin levels. As a result, blood sugar levels can spike suddenly. If you've been managing your blood sugar carefully through diet and medication, but start experiencing unexpected increases despite no changes in lifestyle, it may be necessary to consider the possibility of a pancreatic tumor, particularly pancreatic cancer. Medical professionals closely monitor these changes and conduct thorough examinations when needed. If you notice a sudden, unexplained rise in blood sugar, consult a doctor immediately. Today we explored how diabetes develops, its potential complications, and the reasons behind these serious symptoms. We'd love to hear from you. Have you ever experienced symptoms like these? Have you found effective ways to manage your blood sugar? Or have you faced any particularly challenging situations? Sharing your experiences could help others going through similar struggles. In an age of overwhelming information, it's more important than ever to develop accurate knowledge. Moving forward, we'll continue to explain not just the symptoms and treatments of diseases, but also why these symptoms occur and why certain treatments work using data to provide clear explanations. By understanding the mechanisms behind these conditions, we can avoid misinformation and make informed decisions about our health. Before we wrap up, let's review. Diabetes develops when insulin becomes less effective due to factors such as diet and genetics. Insulin plays a vital role in converting sugar into energy and keeping blood sugar levels stable. We covered 3 common symptoms of high blood sugar: dry skin, weakened immunity, and increased thirst and frequent urination. We also discussed complications such as vision impairment, numbness in the hands and feet, and reduced sensory function. Additionally, we examined how advanced diabetes can lead to reduced insulin production, causing weight loss, while excessive insulin production may increase the risk of certain cancers. Understanding these risks is essential for effective diabetes management. If you found this video helpful, we'd love to hear your feedback, whether positive or negative. Your input helps us improve our content. We'll continue to share valuable health information, so if you haven't already, please consider subscribing to our channel. See you in the next video.